is Nick Ghazarian. I'm an orthopedic surgeon and I'm also a spine surgeon. I'm going to talk about strategies to avoid surgery for back pain. My disclosures are not relevant. I do education, consulting, and design, none of which will affect today's talk. When it comes to back pain, you have options, and this is very important, and we're going to talk more and more about this today. So pain is a big problem. So there's the economic and the non-economic factors when it comes to pain. Pain is very prevalent. Over 80 million Americans suffer from back pain, and a significant amount of money is lost every single year from back pain. People miss work, lots of office visits, emergency room visits, all pertaining to back pain. There's also the non-economic factors when it comes to back pain. Most importantly, quality of life. Significant loss of function, and even suicide risk goes up when it comes to chronic back pain. In the last several years, there's been more and more links found in our research between back pain and depression. So we know that patients with depression are more likely to have back pain, and patients with back pain are more likely to be depressed. And these are some of the symptoms we see. Generally, it's more of a depressed mood, weight gain. People are not enjoying the things that they used to. These are the more common things that I'm seeing. Lack of a memory, difficulty concentrating. In the last several years, more and more research has gone into this topic, trying to identify what triggers chronic back pain and the link between it and depression. We know that it's multimodal, which means there's more than one thing, and it's a complex issue, and it requires a complex, multi-faceted answer. So multiple specialties, multiple different things need to be thrown at this complex issue. I'll give you an example. So you have back pain, and that may be the trigger. That leads to fatigue, weight gain, lack of exercise, low back pain worsens, disability, depression, fear, anxiety, more insomnia, more weight gain, difficulty sleeping, problems with relationships, and it's just like a perpetual cycle, and it gets worse and worse, and it's very complex. And the answer, at least what we think is the answer, is something that it requires multiple different avenues and different specialties. So what are some of the common causes of back pain? So it can occur from the muscles or the ligaments. As we age, so do the muscles and ligaments, and they can be a source of back pain. You can have deformities that occur in the spine. Everyone's heard of scoliosis, which is kind of like the S-shaped curve that can occur. It can be genetic, it can get worse over time. It can also be degenerative, which means related to arthritis. And there's also kyphosis. Now, kyphosis is what we commonly see in the elderly population due to some changes that occur in the discs themselves. And as they collapse over time, they tend to have us fall a little bit forward. And so a lot of us have seen elderly patients walking around like this. We call that kyphosis. And over time, it causes more and more pain and debility. And we've made a link between kyphosis and health-related quality of life. So we know there's a link between quality of life and our skeletal deformities. Osteoporosis, postmenopausal females and males in their elderly years can develop osteoporosis, and that can lead to things like compression fractures. Compression fractures can be a source of pain, and also the deformity that occurs in the spine can cause further kyphosis. And so it's important to see your primary care physician regarding that topic. As we age, so do the discs, and degenerative disc disease or arthritis in the spine, it can cause significant changes, and we'll get into a little bit more about that in a little bit. So the common risk factors, the things we know, and there's been research behind obesity. We'll get into this a little bit more. Smoking, we know that nicotine in the blood can cause changes that occur in the discs themselves. It can cause accelerated arthritis and breakdown of the discs in between the spine. Physical deconditioning. that can promote back pain and problems and job dissatisfaction. As we age, so does the spine. And so initially we see some changes in the disc level. We'll see the discs slowly start to collapse and the room for the nerves become less and less as time goes by. You can also see changes in the bones themselves. You can have bone spurs that occur, like in the fingers, occur in the spine itself. And in certain areas, when we develop a bone spur, the spur itself can compress on a nerve, causing pain, and then also potentially even weakness and issues down the leg. And so it's important to understand that the body is affected by aging, and so is the spine. And we only get one spine, so we have to do our best to try to protect it. So this is a cross section of a lumbar disc. And so if I were to take a samurai sword and chop somebody in half and look at the spinal segment like that, this is what you would see. So you have a disc here in the front, and the outer part of the disc is called the annulus fibrosus. It's a thick structure, and as we age, it becomes drier and it becomes more prone to rupture. In the middle, we have the traditional, what we think of as when we think of a disc. It's the soft kind of jelly matrix. I think of this as like a jelly donut with the jelly being in the middle, and this jelly provides cushion. And so when there is some aging and changes that occur to this outer annulus, it's more prone to having a tear. And when there's a tear, even from a very minor trauma or nothing at all, you can have some of this disc material herniate backwards. And depending on where it herniates, it can cause different types of symptoms. So if it hits the nerve, it can cause nerve pain down the leg, what we traditionally think of as sciatica. And so this is essentially trying to show what's occurring on the disc level. So the muscles that support and surround the spine are critical. And as we age, so do the ligaments, joints, and muscles. And these muscles, they protect and preserve the spinal function. They move when we move, and they have a very important role. And unfortunately, over time, changes can occur to these muscles. Atrophy from disuse, starvation from improper nutrition, and just overall poor health can really affect the muscles that are designed to protect and preserve the spine. And what happens there, if we lose the surrounding structures, then what happens is the discs and the spine itself have more load. So they have more stressors put on them, and so they can accelerate the degenerative process, and people can also have more back pain. So it's very critical. You have muscles in the back, and you also have muscles in the front, which are critical. People just think of lower back muscles, but there's muscles all around. They all serve a function. And I have a picture here of the hamstrings. The hamstrings are on the back of the thigh, and they go all the way up, and they attach to the lumbar spine. And here's a great example. So when you have back pain, you have tight hamstrings. So when you have tight hamstrings, you tend to have back pain. Unfortunately, it's a body's reaction to having a back problem. It tries to tighten up the hamstring, but what it does is it actually perpetuates the problem. It makes it actually worse. And so it's important to have mobility of certain muscles, including the hamstrings. And this is something the physical therapists work closely with me on. So it's all one unit. Everything works together. And so if something's off, it affects something else. That's what I'm trying to get to. So strategies to try to avoid surgery. Back pain is a billion-dollar business. And there's a lot of companies, businesses, both on the internet, on television, trying to solve this issue. Some of them are just gimmicks, and they're selling items that may or may not have any usefulness. So some of the things we know and can do ourselves that have been proven and shown to be of some benefit is, now starting with number one, I think one of the most important is weight control. And we'll get into each one of these a little bit more. Next, we move on to physical therapy, maintaining flexibility, proper mechanics and ergonomics, alternative treatments like chiropractic, massage, acupuncture, changes to our lifestyle, and maintaining a strong mental well-being. So we're going to get into each one of these individually. So weight is very important. So especially weight in the midsection, it can change our center of gravity and pull us a little bit forward. And the spine was meant to be loaded a specific way. And so when it's not, the forces, when they're placed in an abnormal angle, what happens is there's abnormal amount of stress placed on the disc itself. And that can cause accelerated degeneration. It can make you more predisposed to disc herniations, back pain. It's a very important thing to consider. So the data shows just 20 minutes of daily exercise can decrease the back pain by about 30%. And this is low impact training. We're talking about just brisk walks, elliptical, cycling. We're not talking about CrossFit or anything high impact. Physical therapy, very important. A big part of my practice. I've been blessed to be able to work with some very well-known physical therapists throughout the years and come up with my own physical therapy protocols for some of these spinal conditions. The ones that I think are most, they give you the best bang for the buck and are something you can do both at home as well as in the office of a physical therapist. The goals of physical therapy are to increase your functionality, strengthen the surrounding structures, hopefully prevent injury and decrease your pain. So we want to strengthen weak muscles. We want to loosen tight muscles, maintain mobility, function. Some therapists work with patients on proper ergonomics as well. There's lots of modalities. There's heat, ice, stretching, there's mechanical, electrical stimulation, traction. They have lots of different modalities. The ones that I'm most concerned with are the strengthening modalities. So the goals of physical therapy, the way I look at it, is really to strengthen the supporting structures. So to, again, improve mobility, function, work on transfers, and strengthening. So if you look here in the top left corner, you see a cross section of an MRI. You'll see the disc labeled, you'll see the nerve, and the muscles that surround it. You have muscles all around. You have these paraspinal muscles. These are the ones in the lower back. Unfortunately, on a lot of my patients, when I look at the cross section of the MRI, I see a lot of atrophy. I see the muscles that support the spine significantly smaller and weaker than they're supposed to be. And that puts a lot of abnormal stress on the disc and also the nerves. So the paraspinal muscles are the dynamic stabilizers of the spine. Now, what does that mean? It means that if somebody were to throw something at you and you suddenly move or twist, some of that force, that sudden movement that occurs is placed into the muscle itself, and it avoids putting abnormal and harmful stress onto the disc. If we didn't have these muscles and somebody did something and causing you to suddenly twist or turn, you could rupture a disc right away. And so these muscles are very, very critical. They protect and preserve the spine. And as they become atrophied over time, this can predispose you to having problems in your back, including disc herniations and injuries to the nerves. So the abdominal muscles, those are also critical. So people tend to think of the core muscles as the abdominal muscles, but I look at them as the entire spinal protective mechanism from the front, sides, and the back. As the muscles tighten in the abdominal section, it can help protect the spine, and when you want to do a certain movements, they can relax and allow you to do these movements. So they have a very important stabilizing and destabilizing function. So patients with lower back pain tend to have abnormal muscle firing, which means the protective structure is not working the way it should. Core strengthening. So the definition of core stability is the ability to control the position of the center of the body. And so there's certain ways we go about strengthening the core, and generally done with the help of the physical therapist. There's certain exercises that start from relatively beginner and move their way up to more advanced, such as the ones you see here in the pictures. I tend to avoid twisting exercises such as the one in the top right. You see the weighted ball twists. That does strengthen the core, but also it puts a lot of abnormal stress on the disc itself, and so we tend to avoid it. This has been shown to be quite effective in the treatment of chronic lower back pain. So again, I have my own specific treatment when it comes to strengthening, and I work together with some physical therapists on this. So when I send patients out to do physical therapy, the therapists tend to follow my treatment program. This isn't necessarily it, but these are just some of the basic stretches and strengthening that has been shown to be helpful when it comes to lower back pain. And it's important to understand that it's not just stretching. A lot of patients will tell me, no, I do physical therapy. Every morning I stretch, but there's a lot more to it. So maintaining flexibility is really important. As we age, there's some changes that occur in the muscles, the tendons. They become more taut, they become tighter. The collagen matrix is no longer as flexible as it used to be. And so it's important to maintain flexibility. One of the modalities which has been around for a very long time and has a lot of research behind it is yoga. And it's been shown to be as effective as standard physical therapy for chronic back pain, although I tend to use it more of a adjunct modality with physical therapy. So in conjunction, I think they work better as opposed to alone. And within these certain poses, certain muscles flex and strengthen while others stretch, others relax, and you're able to strengthen the core and the joints with yoga. Now, not everybody is a candidate for yoga, and there are patients with certain conditions such as cervical stenosis and whatnot, which they can continue to do yoga, but with certain restrictions, and that's after they see me. So there's been data that shows that patients who participate in yoga were more likely to not take pain medication at 1 year when compared to patients who didn't do yoga. Body mechanics and ergonomics is a very important topic. Our body is a machine, and like any machine, it needs to function efficiently. So it's very, very important, especially now that more and more people are working from home. So the definition of mechanics, it's the way in which the body moves and maintains balance with the most efficient use of its parts. Basically, give you an example, if you're cooking and you have the pot in front of you and you put it out there. And so when you work out here, there's a long lever arm created, and that puts a lot of stress on the thoracic and the lumbar spine. And so that's not a very efficient way of working. Now, if you bring it a little bit closer to your body and create a shorter fulcrum, that puts a lot less stress. And so there's these little changes we can make in our day-to-day life that make a big change. For example, first thing you do when you wake up, you tend to brush your teeth. And so patients a lot of times will brush their teeth and they're hunched over because for whatever reason, they're trying to be as close as they can to the sink. And the first thing you do is go into that abnormal posture, and that puts a lot of stress on your spine. This is something you do all the time. You do it every day, sometimes multiple times a day. It all adds up. And so I recommend my patients put, stand up when they brush their teeth, put a little cup next to the sink, and kind of, if they want to rinse out their mouth, they can kind of use the cup to rinse it out rather than going down towards the faucet and trying to wash their mouth out. And so this is something some of the good physical therapists work with my patients on. And also I do a little bit of this education in my office with some of my patients. Now, when you talk about proper use and efficiency at the workplace, you call it ergonomics. And so having a proper workstation, and we'll get into this a little bit more, but more and more people are now working from home. And so they've had to do a big change in their working environment and not work on the couch or in their bed, but actually set up their own nice little efficient workspace. So it's very important. The time spent behind the desk or doing these other things, it all adds up. It puts abnormal stressors on our spine and can cause early degeneration and other issues as well over time. So just some basic tips when it comes to body mechanics. I think it's important to maintain a wide base. You want to put your feet about shoulder length, shoulder width. If you're going to bend over to do something, you want to bend at the hip joint, not from the back. So avoid hunching over like this, but rather try to bend at the hip. I know some people have some hip arthritis, making it a little bit difficult, but there's still some motion that usually is preserved there. And so that's a big thing right there. You want to avoid twisting. If someone wants to give you something and they're on the side, you want to actually turn towards them, take what you are getting, and then turn backwards. You want to avoid twisting. This puts abnormal stress on the spine, especially when you have some type of load. You have something heavy. You want to really avoid that. Whatever you're doing, get as close as you can. If you're cooking, wear an apron, get as close as you can to the pot. If you're doing laundry, bring everything to approximately the horizontal level. If you're twisting constantly like this, it puts abnormal stress on your spine, and over time it can cause back pain. If you're standing for long periods of time, such as when I'm doing surgery for sometimes 6, 7, 10 hours, I tend to bring one foot in front of the other. Essentially, I'm kind of staggering the way I stand, and I bend that front knee. And what that does is it puts about 30% of the stress from my lower back, and it puts it in the quadriceps, which is a very, very strong thigh muscle. And so now I can stand for longer periods of time, and I may alternate one foot back and forward over time. And so this really helps decrease the stress on your spine. And don't forget to ask for help. Maybe take 2 turns going up the stairs with the groceries. Maybe ask for help when you're trying to move the couch. These little things are very important because saving a minute of your time by trying to do something on your own may cause months of back pain. Okay, so it's very important. And back pain itself is really a first world problem. There's been some research coming out from various different journals comparing the incidence of back pain in our first world technology-driven society and comparing it to third world countries. So let me explain now. Our society, we're behind a computer, we're using smartphones, we're in traffic for long periods of time, compared to certain places where they're still doing a lot more labor-intensive positions. They're out fishing, they're doing manual labor. And so our lifestyle, our sedentary lifestyle, it promotes a lack of muscle tone and a lack of postural stability. And that contributes to our back pain. So it's very important to understand that. So everyone's heard of tech neck, or if you haven't, I'll tell you now about it. Essentially, it's the smartphone, the tablet, the laptop changing our skeletal mechanics. And so you can see in this picture here, when you abnormally flex your neck in that kyphotic position, for example, looking at your smartphone, the mechanics change. There's a significantly increased amount of stress placed on our spine. And this is something we're seeing more in the younger generation. And I think it does translate to people having more back pain, requiring surgery earlier in their lives. In the last year or so, I've done surgery on a lot younger patients. I'm talking about spine surgery, 21-year-old, 24-year-old, 26 years old. And that we know that there is some genetic component to that, but also the environmental factors are important. And so it's important to change these postural issues that people are having and maintain a strong and flexible spine to hopefully prevent issues from occurring. We don't know fully the long-term consequences of this issue, but we know that we need to stop the abnormal posture that we're going into. And we see this more and more in the younger populations. The correct sitting posture, at least what's been described by some of the bigger journals out there, the 90-90 position. So 90-degree bend at the hips, 90-degree at the knee, and placing your feet flat on the ground. If you have to sit at a desk, making sure that the whatever you're doing is approximately at eye level, so you're not looking down for too long or looking up for too long. I think that there are a lot of fancy tables and desks out there. necessarily need to spend thousands of dollars on a chair, but if you can strengthen your core, and that is the best thing you can do for yourself. It's important to try to get up every 45 minutes or so. A lot of stress is placed on the spine when you sit for long periods of time, and that may translate to pain. It may be pain that occurs later that day or later that week. We don't quite know, but I'm sure everybody's been on a long flight and may or may not have had pain afterwards. I know that every time I fly overseas, I do have pain for at least a week afterwards, and it doesn't occur right away. It usually takes a few days, and it's generally related to that lack of mobility and the long period of time when I was sitting, putting a lot of stress on the discs, the muscles, and the ligaments of the spine. So try to get up every 45 minutes, even if it's just for a minute or two, just walk around. I personally use a standing desk. I think it's been a game changer for me. Less stress is placed on your spine when you're standing than when you're sitting. We all know that. And I do take turns and I sit for short periods of time, but most of the day is spent standing. So what about alternative treatment options such as acupuncture? Well, I'll tell you how we think acupuncture works. So acupuncture is essentially the stimulation of certain points in the body that have, what we believe, increase the amount of endorphins. So what are endorphins? They're natural pain relievers. And so by stimulating these areas, we can stimulate the secretion of these natural pain relievers. Now, when you exercise, the same thing occurs. Actually, when you do drugs, the same thing occurs as well. So this may result in the reduction of pain. So I use acupuncture in some of my patients, patients with, for example, an acute disc herniation who's in pain, and I'm kind of watch them, seeing how they do. I'm trying to see if they'll get better on their own, or do I need to do more? During that time of healing, when the body's kind of doing its own thing, I may use something like acupuncture to try to decrease their pain level. Chiropractic massage. Now, there is some similarities when it comes to their goals when comparing chiropractic to physical therapy. Both of the goals are quite similar. Physical therapists call it physical therapy. Chiropractic physicians, they call it physiotherapy. Now, there are similarities. The goal of chiropractic treatments is to improve functionality, reduce nerve irritability, such as from like sciatica, and restore range of motion in the back. They use things like spinal manipulation, I'm sure everybody's heard of, as well as mobilization, stretching, and they have various other modalities as well. A lot of people ask me which one's better. I defer to the literature. There's a decent amount of literature out there comparing the two, and there aren't huge differences among them. Now, sometimes insurance companies will approve physical therapy, but they won't approve chiropractic treatments. I tend to use physical therapy a little bit more, but I do work closely with chiropractors and physical therapists as well. This is a relatively new topic, something I'm not an expert on, but again, when it comes to understanding the source of chronic back pain, there's more and more research going into the mental aspect of it, and there's different modalities that have come up and are being researched. One is cognitive behavioral therapy. It's essentially a type of psychotherapy done by usually a PhD, and it's essentially trying to train people to modify their specific thoughts and behaviors. And this, I have sent patients to the psychologist to have CBT therapy. It's hard to get somebody to go, but when they go, they generally have a favorable outcome. And this works really well, especially in our population. We have, in this community, we have a lot of patients who have not much wrong on their imaging studies, but do have incredible amounts of pain and sometimes sensitivity to touch and whatnot. It's important to try to change their mindset about everything. You know, send them physical therapy. They go one visit, they come back, they're like, oh, my pain got worse, and I don't want to do this, I don't want to do that. Again, there's an element of depression, anxiety, fear, not knowing what the future holds. All these things are contribute to back pain. Another modality when it comes to addressing the mental well-being is called MBSR. I'm not very familiar with it, but it's mindfulness-based stress reduction. Of course, stress has a big component in pain. It's essentially awareness and acceptance of the moment-to-moment experience, and understanding, yes, you do have pain, and dealing with this. I don't know much about either one of these topics. I defer to my psychology colleagues, but I have seen improvement in some patients if they're willing to go. They have to be willing to go. Unfortunately, a lot are not. Doing things you love is most important here. So I'm a physician, an orthopedic surgeon, and my goal is to improve quality of life, or at least maintain and restore some quality of life. And that's really the goal here. And in conclusion, some of the things you can do to try to decrease the amount of back pain you're having in your life, number one and foremost, is weight management. The stress you placed on your spine is critical, and through the years, it really adds up. Remember, don't sacrifice your back. Ask for help. If you're doing something, take the extra time. Take the advice from either your surgeon or your therapist on the proper ergonomics and some of the things they'll teach you. Once you learn these modalities and exercises and whatever it may be, try to incorporate them in your daily workout, in your daily life. So if somebody goes to a therapist or a chiropractor for 6 weeks, gets some improvement, and it comes back home and goes right back into what they were doing, stops doing their daily workouts, they're just going to go right back into it. So you've never seen a bodybuilder just strengthen and get really buff and strong and then just stop, because they're not going to maintain that. They have to maintain that. And as we age, it gets harder and harder to maintain. It's very important. Also, nutrition is very important. It's a different topic altogether, but nutrition, protein supplementation, all these things are important. Remember to maintain your mental well-being. And how do you do that? I don't really know, but try to do the things you love, okay? It's very important. Don't get bogged down by, oh, I have back pain, my life is over, I can't do the things I love. If something makes you happy, do it. Deal with the consequences later. It's important to maintain that in your life. And remember, the treatment for back pain is multimodal and multidisciplinary. So if you get a referral to see it, for example, a physical therapist, and then you don't get much improvement, it's not the end of the world. So that's just one modality. We have lots of other modalities, and sometimes we have to do these at the same time. And unfortunately, insurance companies don't always agree with that. But the new approach to this is a multidisciplinary, multifaceted approach. It goes all the way from the mind, all the way down. Lots of things need to be addressed when it comes to chronic back pain. Thank you very much.
Thank you, doctor. Oh, this is great. I was going to ask you if you had that for us. So I will be making a video of this that I will share on our website, and Dr. Ghazarian, I will share that with you too, so you can share that. And I think I would like to, at this point, open up our chat feature for questions that anybody might have from Dr. Ghazarian. Let's see, looks like there are a few. Doctor, if you'd like to just read the questions, and if you wouldn't mind answering them, that would be terrific.
Sure, no problem.